Hello, my name is Alexander Alvarez. I am an athletic trainer, and the purpose of this video is to look at exertional heat illness diagnosis and treatment. There are various types of heat illnesses. Examples include exercise-associated muscle cramps, heat syncope, exertional heat injury, but for the purposes of this video, we will be focusing on heat exhaustion and exertional heat stroke. Heat exhaustion is the inability to effectively exercise in the heat, secondary to a combination of factors including cardiovascular insufficiency, hypotension, energy depletion, and central fatigue. These individuals will have a rectal temperature of less than or equal to 104 degrees Fahrenheit. Treatment is to cease exercise, remove from hot environment, elevate legs, provide fluids and ice bags. The athlete should not be allowed to return to play in the same day. Exertional heat stroke is the most severe heat illness. It is characterized by having a core temperature of 105 degrees Fahrenheit or higher and neuropsychiatric impairment. This is a medical emergency. Treatment involves whole body cold water immersion to quickly reduce core temperature, then transport the athlete to the hospital. Signs and symptoms for heat exhaustion and exertional heat stroke are similar in nature. The following are examples of signs and symptoms that you can see with an individual with heat exhaustion. The two main signs that distinguish an individual from exertional heat stroke from an individual with heat exhaustion is personality changes and combativeness. The other signs and symptoms are very similar to individuals with heat exhaustion. However, to truly know if a patient is having an exertional heat stroke, we need to assess their core temperature. The assessment of rectal temperature is the clinical gold standard for obtaining core body temperature of patients with exertional heat stroke.
To assess rectal temperature, you should have the patient prone, rotate their hip to their side, and raise the superior leg towards their chest. You will then take the rectal thermometer and turn it on. The thermistor should be connected to the device and should give you a reading of the ambient temperature. You will then lower the athlete's shorts to access their rectum. Insert 4 inches of the thermistor into the patient's rectum. If blockage is encountered, remove the thermistor and try again. Once the thermistor has been successfully inserted, the temperature shown on the rectal thermometer should be displayed. Once core temperature is recorded, the parts of the thermistor closest to the patient should be taped on to prevent the thermistor from being pulled out. In this example, we use 2 pieces of tape, one on the buttocks and the other one on the hip. Once the thermistor is secured and cold water immersion treatment is indicated from the reading, rapid cooling should commence. During this process, it is best to drape the athlete or have medical personnel hold up towels so that the patient is not exposed.
Cold water immersion is considered the gold standard for rapid cooling. There are different forms of cold water immersion, which include using a cold tub, whirlpool, polar pod, and a tarp, aka the taco method. Vitals should be monitored whenever cooling the patient. The taco method is an inexpensive method for cooling. However, it requires multiple people to assist in the process and can cause fatigue to the individuals performing the technique. To perform the taco method, you must first set the tarp. Make sure the tarp is not too long. You'll then place the patient on the tarp. Have someone take the head and place the towel behind the patient's torso and put the towel through their armpits to help support the patient and prevent them from drowning. The person at the head will be in charge of dictating what everyone should be doing. Once everyone has taken their positions, lift the edges of the tarp and apply sufficient water and ice into the tarp. Shake the tarp to make sure that the water stays cool to help cool the patient faster. Be sure to have someone monitoring the rectal temperature. If a rectal thermometer is not available and core temperature cannot be taken, be sure to cool the patient for about 15 minutes before transport.
As previously mentioned, have the patient laying on the tarp. Use a towel to help support the patient at the head to prevent drowning. The edges of the tarp will be lifted, and although not shown in this video, water and ice will be applied onto the patient. The individuals holding the tarp will then be instructed to help shake the tarp to help cool the patient faster. You will do this for about 15 minutes or until the patient's core temperature has reached 102 degrees Fahrenheit or lower.